Hi, welcome to Education Alchemist YouTube channel. Today's video is a presentation with Professor Gilly Salmon and Dr. Lisa Taylor about PEEP, Peer Enhanced E-Placements, an innovative technological and pedagogical answer to placement capacity emergencies within health and social care workforce education.
Hello everyone, I'm Gilly Salmon from Education Alchemists, and we're going to talk today about the work we've been doing with virtual placements. And I've been working with Dr. Lisa Taylor, who will briefly introduce herself now.
Hi, I'm Dr. Lisa Taylor. I'm an Associate Professor in Occupational Therapy from the University of East Anglia in Norwich and Norfolk. And I was the creator of the original Peer Enhanced E-Placement, the PEEP. And I've been working with Gilly Salmon over the last 8 or 9 months, isn't it, Gilly, in order to develop the PEEP and the underpinning pedagogy and scaling up of the pedagogy and the PEEP implementation.
So that's what we're going to talk about today. So we've got a few pictures for you just to guide us through. So this is what's in this video. It's about an issue which we call a logjam in placements. It's about the pivoting that we've been doing to take virtual placements forward as a solution. It's about the pedagogy and learning design on that. And then what happened when Lisa implemented it with her students, and then we scaled it up with others. So that's what we're going to talk about today. So first of all, of course, the increase in student numbers throughout health professions. Now, we've got statistics of what's going on in the UK. You may need to have a look about wherever you are to see what the statistics are there, but nearly every country, every set of universities in the world is increasing health placements. And it's completely traditional to have a physical placement across all health professions, which is considered to be traditional and essential for nearly every health professional. Now, of course, when COVID started, which for us, speaking in January 2021 was about 10 months ago, there was real challenge and many of these couldn't go forward. But since then, of course, there's been quite a lot of need for recovery on these, but the ongoing placement capacity issue has not gone away either. So you can call it a logjam, you can call it a perfect storm, but this is what we've been facing. So my work was brought in to understand what happens when you move from face-to-face learning to online. And it is important that you understand some of the absolute key issues on that. First, you can offer much better peer collaboration than you can in a one-to-one face-to-face situation, but students must have good accessibility, and sometimes you can outreach with accessibility. Learning, knowledge and practice absolutely can be equivalent. And in many cases, it can add some emergent value that is unanticipated. And that's what happened to us. But you must make sure there's scaffolding, structure and pacing. And you need to prepare your case studies because you haven't got your live patients. And they might be simulations or scenarios. Critically, the learning outcomes remain the same. So these were our principles for the first PEEP and for the ongoing placement since. So Lisa's first going to introduce what she did for PEEP number 1, which was in April 2020 with occupational therapy students. Over to you, Lisa.
Thanks, Gilly. As Gilly said, the original PEEP was designed for occupational therapy students. Our second-year occupational therapy students had their placement suspended because of COVID, and we needed to seek an alternative placement, but a placement that did provide that equivalence of learning towards their placement learning outcomes. So the original PEEP was very much designed around those placement learning outcomes being at the core. And that's the sort of first of the three key considerations when we're looking at a PEEP, is the fact that those professional standards and specific placement learning outcomes need to be first and foremost at the start of you organising your PEEP, to make sure that that learning journey continues for the student, but it's also a validated learning journey that has already had that external validation from the professional bodies with regards to the course programme delivery. The other thing around the original PEEP, or with the PEEP pedagogical principles, the way that the storyboard and the timetable built up all of the scaffolding, etc., that Gilly's just alluded to around the learning, to make sure that the students were constantly building towards their placement learning outcomes through the rich pedagogy around the peer group learning. So the whole thing about the peer enhanced e-placement is that students learn in their peer groups, and that has a very strong evidence base underpinning it. Alongside the digital ecosystem, we used a virtual learning environment, Blackboard, but other technology systems that can support the key principles of that digital delivery, such as the ability to house resources, the ability to have meeting space, etc., were another crucial consideration around the development of the PEEP, and very much built along Gilly's work around that online learning and the sort of environment that students need in order to support that. It's represented very much within these 5 stages of learning. When we evaluated the original PEEP, the students reported, and those educators who are involved with the delivery of the PEEP, provided that the evaluation of the PEEP, and actually from the themes that came from the evaluation, it seemed to very much reflect these 5 stages of learning that Gilly has been sharing over decades, and has been established and well established within the literature as an accepted model for online delivery of learning. And the evaluation very much showed those 5 stages of learning, and it was represented in various different aspects of the student learning. So there was things around the peer learning, which was really, really supported by the PEEP, and the students found really useful. There was the things around critical reasoning that was, and critical professional reasoning, that the students really found valuable as well. Those elements about being able to look at things in a bit more depth without the feeling as though they're being assessed all of the time, and having that ability to question and explore their learning in what they classed as a safe environment, and the ability for them to build on their sort of caseload management and organisational skills as well. We did have some feedback from the students and the educators, and you can see here some of those key aspects that came up from the analysis around the confidence in their professional reasoning, the ability to manage a caseload, even though it wasn't a face-to-face caseload, they were still managing a caseload and developing those things that you'd be wanting them to be developing anyway on their practice placement experiences. And we were able to replicate that practice placement experience that the students otherwise would have been having on a face-to-face basis, but actually being delivered within an online environment. When we found the results of the evaluation, we really felt that we needed to share it more widely. We were probably one of the first of the HEIs to adopt an online delivery of a placement, and having had the evaluation come through so strongly, not only that students had achieved their learning outcomes, their placement learning outcomes, but how they had learned them, and how the peer level of it and the online delivery of it would be something that would perhaps be attractive to others, given the current COVID situation, and beyond COVID, the ongoing placement capacity issues. Gilly and I worked together to scale up the PEEP acquisition package for individuals to be able to adopt the PEEP, and it's delivered in 3 stages. So those participants who are looking to come onto the PEEP acquisition package, they explore their professional standards and their understanding of the key pedagogical components of the PEEP. Again, focusing on those placement learning outcomes being central to any PEEP. Those people who are wanting to deliver a PEEP need to be very sure about what stage of the learning that the students are going to be using a PEEP for. That is then brought to the workshop environment, where we go into more of that pedagogical underpinning, just to give that confidence and reassurance about the delivery of how to actually design the PEEP. And then the group work towards the end of the workshop enables people then to start to customise it, to work around and hook all of those elements of the pedagogy onto their student learning needs. Then there's a follow-up where the participants complete a quiz, and then they're given a student e-handbook, which is a part of the resource I developed for the original PEEP to support the student reflective journey and for them building their evidence towards their placement learning outcomes as well. So we piloted the PEEP acquisition package back in the summer. We piloted it with a number of different professions. 100% agreed that the workshop engaged themselves in how to implement a PEEP locally, and 100% planned to implement to replace some of their current practice placement provision with their PEEP. We've already heard back from some of those participants to say they've actually done that and have had similar feedback to what we got from the original PEEP in relation to the student learning and the rich learning they got in elements of the placement experience that they might not have otherwise have got as well within the face-to-face environment. So after having delivered PEEP acquisition packages over the 6 months from July to December, we have worked with 25 course teams that have spanned 15 different professions and fields of various professions. The average student numbers on the cohorts who have been attending the acquisition packages have been 69, and the plans that people have got for their PEEP to be implemented is to implement a PEEP that's about 3.5 weeks long on average. But those people who have got these plans in place to implement a PEEP, having come on the PEEP acquisition package workshop, that means that it has generated potential placement capacity of over 6,000 weeks. So we've been busy over this last 6 months, really scaling up and rolling out the PEEP acquisition packages so people are able to adopt and customise it for their own individual needs. This is some of the feedback from participants, just really reinforcing that sort of change in mindset and the pivot in learning from that sort of traditional face-to-face learning to the online delivery, and how that has almost had the participants had a pivot in how they've been approaching how they can implement a placement.
So thank you very much, Lisa. So the way we have designed the PEEP, I think offers an equivalent and online option for the traditional face-to-face placement delivery. It doesn't necessarily replace it all, but it doesn't definitely help with the logjam. And we've also demonstrated that the PEEP processes can be customised and quickly adopted for a wide range of health and social care professionals. We're also interested at the moment in other people, such as sports scientists, education, engineering, who also have placement-based internships. So if anyone's interested in contacting us to pilot on those, that's where we're going next. So here's some more information for you. Please look at some of the other videos on YouTube, and I'm sure Paula will put a lot more information underneath the video. So thanks very much for listening, and good luck with your virtual placements.
Thanks so much for watching. I'll put below the links that might be useful for you. And if you are interested in doing a PEEP, please get in contact with Education Alchemists. We'll see you again soon.